Welcome back. Today, we're turning turquoise to raise awareness of the leading cancer killer of women and men in the U.S. We're talking about lung cancer today. There is hope. The lung cancer survival rate is up 33% over the past 10 years. So joining us now, we have pulmonologist Dr. Mohammed Al-Janabi. Good to see you. Thank you for being here. And then we have Trini joining us and your mom, Gloria. It's great to have you both.
Thank you for having us.
Thank you. You know, this is such an important topic, and we want everyone to think about wearing turquoise this week, right?
Yes.
Okay, let's start with you, doctor. I mean, you're a pulmonologist, so you see what happens with lung cancers. Tell us how important it is that we do what we can to prevent this.
So, unfortunately, cancer still is the leading cause of death in the United States. In general, cancer is the second leading cause of death, and lung cancer is the main leading cause of death out of all cancers. And the guidelines, there are guidelines for lung cancer screening, meaning if you are at a risk group, you need to be screened for lung cancer to detect the cancer early. And that, can, increase your survival to, actually, if we detect lung cancer early, your 5-year survival can go up to 60%.
Okay.
When it's late detection and the disease has advanced, then that survival goes down to less than 20%.
Wow.
So the guidelines are there. It has been there more than 10 years, and recently the guidelines were updated to include more people in the community.
Okay, so early detection really is key.
Is the key.
Okay, and Trini, I want to ask you, because I know your wife, Crystal, she lost the battle to lung cancer, is that right?
That is correct.
Okay, I'm so sorry for your loss. I know it takes a lot to come on here and talk about this, but tell us, what is your message that you hope to get out?
Well, first I would like to tell her story.
Yes.
In 2016, Crystal passed away. My wife, Crystal, passed away from a rare lung cancer. At the time, we didn't know what was going on. She was very strong, she was very healthy, very energetic, had a heart of gold. She started feeling pain in her back shoulder, and we thought it was just a pulled muscle. And then we found out that she had cancer. So early detection,
right?
Oh,
that's so heartbreaking. And I mean, for her lifestyle, healthy, active, but breathing could be a danger.
Yes.
I mean, the air we breathe, right?
Right.
What did you kind of learn about lung cancer? Was this ever a concern that you had prior?
No.
No. Oh, yeah. So that's something I don't think that many people think about.
Right.
We don't realize how much around us could cause this. Can you explain that, doctor? I mean, what is the cause of lung cancer even? What can lead to it?
So smoking is one of the major risk factors for lung cancer, and then of course occupational exposure, air pollution, sometimes genetic predisposition, or even a mutation. So 30% of between 20 to 30% of people who have cancer are female who are non-smoker, and they are diagnosed with what we call adenocarcinoma. So not necessarily that you are a smoker, you need to be screened. Ask your doctor if you qualify for lung cancer screening.
Okay.
And that's why at Grossmont Hospital we established the Burr Lung Clinic to be like the hub, serve the community in the East County or even in San Diego in general. Just come in and ask if you qualify for lung cancer screening. And what lung cancer screening include is that we do a low-dose CT scan that detects, small tumors early in the course of disease. And we have the most recent technology to have tissue sample biopsy of these tumors without the need for surgery, without the need, for hospital stay. You get the procedure and you leave the hospital same day, and with a peace of mind, whether this is just inflammation or a scar tissue, benign tumor, or a cancer.
Okay, so you can ask to get yourself screened, to get this scan that's so important.
Yeah.
And Trini, you work at Grossmont, right?
Yes.
I mean, to have this, available to patients, I can't imagine how life-changing that is now, right?
yes. Crystal did, she passed away at Grossmont.
Oh.
Yeah, while we were
so sorry.
And with my engineer family, they kept me strong. So.
Your mom included, right? Yeah, and I see the pin of her beautiful face on there.
Oh, she was
her picture,
beautiful. Beautiful, inside and out.
Yeah. And at such a young age, I would imagine.
34.
A non-smoker. I know it's something that I think so many people don't realize. It's the #1 cancer killer still. Yeah. So the scanning, the early detection, so important. And I am curious, who qualifies? I mean, is it people who live in certain neighborhoods where pollution is high?
No, so the current guidelines, if you are between the age of 50 to 75 and you smoked for what we call 20-pack year smoking. So if you smoke 1 pack a day for 20 years or 2 packs a day for 2 years, for 10 years, then you qualify.
Okay.
But again, a lot of people who are, had lung cancer, they are not a
Right.
smoker, again,
Non-smokers.
female. So not necessarily to stick to the guidelines. These are in general the guidelines for people who
Right.
smoke, but it doesn't hurt to ask your primary
Right.
doctor if you qualify for lung cancer screening. If you have family history, if you have personal history of cancer, sometimes lung cancer can happen with other cancers.
Right, right. Okay, thank you for your insight. Thank you for sharing your story.
Thank
I'm
you
so
for-
sorry for your loss, but hopefully it helps a few people who are watching right now.
We hope so.
Appreciate it.
We hope
Thank
so.
you.
Thank you.